And welcome back to Life Unrehearsed. Matt Del Vecchio here, getting you pumped up as the Owls get prepared for the Grey Cup, which is going to be kicking off in about 2 hours from now. We're going to wish the boys the best of luck in Hamilton, playing the Winnipeg Blue Bombers. And speaking of pumping it up, did you know that the month of November is National Diabetes Awareness Month? Boy, how's that for a segue? That's stretching it a bit, maybe. Well, in studio with me, I have Jessica Carter. She's the Regional Director, Eastern Canada for the Juvenile Diabetes Research Foundation, known as JDRF. And JDRF is the leading organization in fundraising research for type 1 diabetes with an aim to end T1D worldwide. Jessica, welcome to Life Unrehearsed.
Hi, Matt. Thanks for having me.
Well, thank you for coming into studio. Such an important topic. Diabetes is just seems to be more and more prevalent. And for those that may not know, can you please, I guess, describe the different types of diabetes?
Absolutely. So type 2 diabetes can often come on due to lifestyle factors. Your body is still producing insulin. It just needs a little help to be able to use it properly. So type 2 diabetics can manage the disease with food, exercise, and some forms of medication. Type 1 diabetes, on the other hand, it's actually an autoimmune disease, which means that your body actually kills off the insulin-producing cells within your pancreas, leaving you dependent on taking insulin from an outside source, either via an insulin injection or an insulin pump.
So type 1, whereas type 2 might be somewhat lifestyle, type 1, you have it, right? It's not even lifestyle.
No, it can come on just like that. You could be diagnosed at a young age, like 6 months, 3 months, to in your 50s, 60s. It used to be called the juvenile diabetes. However, we're seeing that type 1 diabetics are really being diagnosed at any age right now.
That's an interesting point because it just isn't juvenile anymore.
No,
in fact,
not at all.
you are, prime example. I think you were diagnosed at the age of 15,
Yep.
not very young, and that must have been quite a bit of a shock with type 1 diabetes, correct? And so I'd like to hear just your day-to-day life, Jessica, having type 1 diabetes. How does it affect you?
So I was diagnosed when I was 15. My mother started noticing some symptoms. I was losing weight. I was drinking a lot. I was running to the bathroom all the time. And then one day she picked me up from work, and I just told her that I felt really, really nauseous. I was rushed to the hospital from the hospital in the country. I was driving into the children's hospital for a 3-day crash course on how to manage the delicate lifestyle of a type 1 diabetic. And I've had my ups and my downs, and I still do, my highs and lows. Through adolescence and young adulthood, I kind of rebelled, didn't take any insulin. Ended up with some serious complications that I'm very, very lucky. My body was able to regenerate itself. I guess I slept a lot. And then started taking care of myself a lot better. Had 2 beautiful pregnancies. Managing type 1 and being pregnant is a whole nother ball game, but it affects from the morning you wake up to even while you're sleeping.
This is 24/7, right? This just
Absolutely.
isn't, this week, that week. This is every single day of your life. What I didn't know also, even stress and anxiety can affect your levels. And just, behind the scenes here, just seconds before we went on air, she goes, look, Matt, and was it your blood sugar level?
Yeah.
Is that what it is?
Yeah.
You monitor that all the time. I'm at 19.
Yeah.
That's not very good.
No.
My mom's not going to be very happy with 19.
Sorry. Sorry, Mom.
So what is normal for you?
So we really aim to keep it between 5 and 7 or 4 and 6. Like that is really the target number that you want. Now, being diabetic, it's not just taking a shot and walking away from it. It's you're constantly trying to make sure that your sugars are within that specific target range. And everything like stress affects your sugar levels. Obviously, eating and drinking is the number one thing. And most everything has any type of carbohydrate in it will make your sugar levels rise. And then you have to bring it down with insulin. But if you calculate wrong, which sometimes, human nature, you make mistakes, your sugar levels drop.
Amazing. Just you're listening to Life Unrehearsed. Matt Del Vecchio here. I'm talking diabetes with Jessica Carter. She's the Regional Director, Eastern Canada for JDRF. And as you heard, Jessica also has type 1 diabetes. Technology is playing an increasing role in the treatment of diabetes. Here you are. You showed me your phone. Just like that, you're at 19. By the way, after this interview is done, what do you do? You've got to address this, right?
Yeah, absolutely. So technology has come so far. I was speaking to somebody a couple of weeks ago at an event in Ottawa, and she'd been type 1 diabetic for 50 years. She used to have to urinate on a stick, and the stick, she would have to color code and see what approximate range her numbers would be. Now we have, from that we went to finger poking. From finger poking, we now have CGMs, continuous glucose monitors. So it's a device you wear on your body, and it talks to your phone or another device, and it basically tells you what your sugar levels are at all times. It will also set an alert. So if my sugar levels are going too low, it will wake me up in the middle of the night with an alarm. Because as we know, we go into those REM sleeps, like your last guest, and something needs to wake you up. So if I'm having a sugar low in the middle of the night, my alarm will go off and let me know. So great for me as well as parents of young kids with type 1 diabetes. It's life-changing.
Yeah, you were saying, it's helping. But technology is literally helping moms sleep better because
Absolutely.
they're less worried about their children, whereas normally they'd have to get up, and now it's all being monitored. Just amazing for that.
There's also insulin pumps.
Mm-hmm.
Insulin pumps, we used to have to take injections. So now the pumps are available. You can also worn on your body, and you still need to do the calculations. You add in what you want to inject, and your insulin pump will deliver the insulin gradually. And there's also a little bit of artificial intelligence linked in there too. Some pumps, not all, but some do take a little bit of that human calculation out from you. If your sugars are dropping, your insulin, they'll cut the insulin, or if your sugars are rising, it will add in a little bit as well.
Interesting. And the research that's being done, it continues to evolve. Now, I want to talk very quickly, we've got about a minute left, about the research. You are the Regional Director, Eastern Canada, for the Juvenile Diabetes Research Foundation. We know it as JDRF. So can you tell us a little bit some of the support available through JDRF?
Absolutely. So JDRF, really 70% of our research funding research is for cure therapies. 30% goes to advocacy and programs for the community. So we really want to bring the community together, make sure they're healthy, so that when we find a cure, they're ready for it. So we have mental health programs, because that is a huge part of also being type 1 diabetic. We have advocacy programs advocating to the Canadian government to make sure that we can have access to these insulin pumps and CGMs. We have programs to bring the young type 1 community together and connect one family to another, so that we can really create a community.
Yeah, no, and it continues. It's amazing. I didn't realize how many people are involved with JDRF internally and helping literally millions of Canadians, and of course their families as well, making life better for them. So how could our listeners find out a little bit more about JDRF?
Yeah, so you can simply go to our website at jdrf.ca. We have amazing programs for the community out there that range from fundraising events to advocacy programs, and we are so appreciative of all of our donors and our community for their support. So thank you.
Well, no, and I want to thank you coming in here on a Sunday in studio. Very, very informative. Really appreciate your time, Jessica.
My pleasure, Matt. Thanks.
All right, that's Jessica Carter, Regional Director, Eastern Canada for the Juvenile Diabetes Research Foundation. Next up on Life Unrehearsed, we're going to look into the future. I've got best-selling author and popular science broadcaster Jay Ingram. He's going to be joining me to discuss his new book called The Future of Us. Really fascinating book, as we're going to talk about, again, how AI will affect us, robot technology, what foods we will be eating in the future, and even what we're going to look like in the future. That's coming up after a CTV News update.